Okay, it's Dr. Buford. We're just getting started on your right shoulder here. We're looking in from the back to the front. Everything you see is magnified 30 or 40 times on the screen. Right now, we've got a blue cannula coming in the front. You can see it here. Your biceps tendon is on the left, running up towards the top of the screen. As that exits the shoulder, we can look up there, and that looks normal. We can look down at the biceps insertion, and although it's a little bit frayed, it's not torn. So we would call that kind of a type 1 slap lesion, doesn't need any kind of surgical repair. And then as we look towards the back of the shoulder, we see some of the anatomy back here. That's the posterior band of the inferior glenohumeral ligament there. So again, this is the back of the shoulder. You can see that thickening in the capsule there. Pretty good shot. We can rotate around and look at the insertion of the capsule into the humeral head. As we slowly pull back around, we can see the normal bare area of the humeral head. And now we're going to come up to the rotator cuff. This is where we know you've got some high-grade partial thickness tearing. Before we put our marker stitch, which will pass, get rid of it, just drop it. Before we pass that through a spinal needle, we'll need another number 1 PDS. We will look down the front of the shoulder. So here we're looking at the anatomy down the front. This is the anterior labrum. We can put our shaver in and smooth out any areas that might be just a little bit rough. Remember, the magnification here is pretty significant, so things that may look really large are really just millimeters in size. And so as we look down the front here, the anterior anatomy looks pretty good. There's really not as much of an anterior band of the inferior glenohumeral ligament, but that's it right there, that thickening that you see right in the middle of the screen now. So that's the anterior band. The posterior band, remember, was back over here. We can see the leading edge of the subscapularis tendon, which is just to the right of the blue cannula. So that's the leading edge of the subscap. That's the superior border. And then crossing that here, that is the middle glenohumeral ligament, just at the tip of the blue cannula. I'm kind of tracing its path here down to the labrum. That's the middle glenohumeral ligament. Again, the anterior band is going to be down here. Probe. Or crochet hook's fine. So again, this would be the anterior band, this little thickening right here. The middle glenohumeral ligament is going to be right here. Subscap right here. Okay, and so now we're going to look back. And I know from the MRI scan where the tendon has this partial tear in it. So we're going to take a spinal needle and mark that spot, which is really just behind the biceps tendon. Right about there, okay? And so we're going to go ahead and pass a marker stitch through here. We don't want to commit you to, hold the camera here. This is a number 1 PDS. We don't want to commit you to anything without making absolute certain that you need it. So we'll go ahead and pass this through, and then we'll go off on the video and change positions with your shoulder. Pause. Long press. I'll press longer. Okay, so we're looking at the rotator cuff. We're on the superior surface now. So we're up on the other side from what we initially were looking at from inside the joint. And as we look here, we can see our marker stitch and see it's going right through a red area or a little bit of an inflamed area. That's where we need to investigate. So far, actually looks pretty good. It doesn't look like that tear extends all the way to the surface. So if that's the case, that'll be good. And we'll just do our decompression. You do have a pretty good-sized bone spur. We'll show you that in a minute. But right now, we just want to make sure that there's not a tear that needs to be repaired. And now we're getting a pretty good look at that cuff as we rotate. That's internal rotation and then external. We'll go ahead and pull the marker stitch. And now we'll get a really good look at the cuff. That's full internal rotation. That's full external. All the way up to this anterior cannula. And I think this is going to end up being good news in terms of the rotator cuff not being torn. At least not torn where we need to repair it. Let me show you the bone spur that we're dealing with here. We'll go off on the video and show you some more in a minute.